Hello, I'm Dr. Brian Anderson, a chiropractor here at Shepherdsville Accident and Injury Chiropractic. If you've been hurt in a car wreck, chances are you're going through a difficult, stressful time right now. Between being in pain from your injuries, maybe you've had to take time off from work because of your injuries, and if you've taken time off from work, you're trying to figure out how you're going to pay your bills, you're trying to figure out how to get your car fixed or replaced, you're dealing with the insurance company, maybe you decide you need to hire an attorney. How do you find the right attorney? If you hire an attorney, they're going to expect you're seeing a doctor to treat you for your injuries. You know what? I get it. I wouldn't wish these problems upon anyone. And with that being said, there's something you should understand about the uniqueness of accident injuries. Because they happen so fast, literally within tenths of a second, they have the potential of causing permanent injuries, permanent ligament injuries. The insurance companies, they'll commonly downplay these as soft tissue injuries, in which they expect you to recover from it within 4 to 6 weeks. But what the research is showing us is there's a fairly high percentage of these injuries that are actually lasting for decades. Not weeks, not months, but decades. For example, in 2006, the British Journal of Bone and Joint Surgery published a 30-year study in which they found that roughly 55% of the people still had problems from their accident 30 years previous. And there's been several other studies that are similar to this with, 2-year follow-up, they're still in pain, 5-year follow-up, 7-year follow-up, 15-year follow-up, still in, depending on what study you read, ranges anywhere from 40-something% to 83%. So, with that being said, these injuries can be quite serious and have some long-lasting effects. On top of that, they also found these people with these chronic injuries actually end up having to spend anywhere from $9,000 to $19,000 per year to manage their injuries with medical treatments, medications, physical therapy, rehab, chiropractic visits. Some of them need, honestly, end up having to have surgery. But, the unfortunate thing is, a lot of these ligament injuries actually, they get missed, they get misdiagnosed, they don't get treated properly. And because of that, a lot of people end up missing out on getting, a fair settlement. They take whatever few $1,000s the insurance companies offer, at the end of the case, and then several years go by and they're still having problems because of it. And they, took that, $3,000 or $5,000 check or whatever already, and they're pretty much stuck. So, what do? Okay. First of all, you need to find a doctor that understands ligament injuries and that they can actually be permanent, and how to properly diagnose and how to properly treat these injuries, so that basically to mitigate the long-lasting effects as much as possible. And if you do have a permanent injury that's properly diagnosed, it's identified, it's documented, and if it does end up being permanent, that you get an impairment rating. The impairment rating is going to play a huge role in basically the outcome of your legal settlement, as far as what kind of benefits you're going to get. So, if you think you've been hurt in a car wreck and you're suffering with neck pain or back pain or headaches or dizziness, shoulder problems, knee problems, whatever pain that you attribute to the car wreck, I encourage you to call the number that you see on the site or the car that you got, and then you can call, ask any questions, schedule an appointment. We can evaluate you and see if it's something that we can help you with, and find out if you do have a permanent ligament injury. Also, on my next video, I'm going to share some more information on what not to do if you're in a car wreck and there's minor damage but you still get hurt. What you don't want to do in those circumstances. So stay tuned for that video. Just subscribe. Give us your email address, and I'll go ahead and have you send that out to you. Thank you. Have a great day.